I've asked Tom if he could kind of encapsulate what we have accomplished today in the past 2 days with our screening and treatment of his wife. So Tom, I'll turn it over to you.
Okay. Well, I think we came here with the idea that we had a lot of sacral instability, and you were able to help us with identifying what was in, what was out, and mostly helping us eliminate some issues and help us refocus our attention on some of those things that we were attributing, some of the pains that we were attributing to the pelvis, to nerve issues.
If I can interrupt you, you came with the belief that you had an unstable sacroiliac joint.
Right.
And so you came to see me for my sacroiliac specialty, if you will.
Right.
And what then did I encounter and teach you?
Yes, we were able to rule out hypermobility of the left ilium, left sacrum, and we were able to put her in better alignment. We were able to get some movements that we could do at home that would help her with her stability, her walking, gait.
And so thinking back, I'm sorry to interrupt here, but reflecting back on what we found, I told you on day one, this is straightforward. Straightforward. You have a right anterior ilium, which really involves the whole pelvis. It's not in the joint. It's really the pelvis twisting in a certain way, okay? About a certain axis that makes it look like it's one-sided. However, your pelvis was stuck off to the right side in side glide.
Right.
So the first order of business was to glide it back to neutral, which we accomplished easily, and then work on the anterior ilium. But in child's pose, a yoga position in which you're fully bent forward, sitting on your heels and bent forward, we found a posterior ilium on the left.
Right.
We treated that, restored motion. Today she moves beautifully. She has fabulous sacrotuberous ligaments. The joint is stable.
Right.
Okay, looked at the x-rays, looked at the CAT scan. Sorry, it's stable. I do the spring test, it recoils beautifully. This is a stable SI joint. So we need, I've worked on putting that one to rest. It's not the SI. So I'll turn it back to you, Tom.
Yeah, those issues that we had that really should have been fixed are now fixed, and it really allowed us to focus on those outside issues. It was odd that laying down we couldn't see much, and then child's pose we were seeing much more on the left, and then through your corrections she was able to gain a lot more of her own mobility overall. Some of the things we didn't know about, like the ankles, and the shoulder, the rib, and the upper portion of the back. A lot of these things that I don't know if they were from compensation or what, but we were able to fix those and rule out some of this hypermobility that we thought we had. So I think that's been great.
So what's the take-home message? I'm not sending your wife out feeling remarkably better, and she's walking better. The pelvic component is better. The rib, as you mentioned, is better. The shoulder, we unlocked that AC joint. Unlock the ankles, okay? And that's about where I would stop. I think the rest of my care was kind of educational.
Yes, absolutely.
And so what's the bad news? What's the limit to my work?
Right.
Which is actually good news if you're getting clarification. If you're getting clarity that helps you get the right care quickly, then I guess it's a positive spin.
Exactly.
So let's talk about that. If you could kindly mention that.
Yeah, I think at this point we were able to say that she definitely has lumbar issues, disc issues, some nerve entrapment issues from previous surgery. We were able to identify those and rule them outside the pelvis structure, and that is a whole other journey that we'll have to go on from here, and we're able to say, let's put that to the side and work on the issue at hand. So
Yeah.
you were able to help us with it, what you were able to help us with, and send us on a journey for what we need to attack next.
Yeah, it feels to me like we have a clear picture of what it needs now.
Yeah,
and we have a clear picture of this is my limit. This is where I step back and say this is out of my purview.
Yes, exactly.
So I think we can stop filming. I'm grateful for your, your commentary here.
Well, thank you. It's been, I don't think you get that anywhere else. Yeah.
Thanks very much.
Thank you.